Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, great story to share today with our listeners. When Ahmed Mohamed's family came to Rochester, Minnesota in 1996, they were seeking refuge from the civil war in Somalia. Now, Ahmed, when they came over, was 6 years old, and he only knew 3 words in the English language. Now, by the time he'd reached 4th grade, he'd mastered English, really. He'd mastered it so well that he was able to graduate from Rochester Public Schools' program called English for Speakers of Other Languages. And in his teen years, Mohamed would accompany his grandmother to see her doctor and serve as a translator, remembering everything that the doctor said and relaying the information about his grandmother's health to his family.
That's a great story right there.
Enough said.
Those doctor visits inspired Mohamed to pursue a career in medicine. And now here to share his story from refugee to MD is Dr. Ahmed Mohamed. Welcome to the program. It's very nice to meet you, Dr. Mohamed.
Thank you for having me. I really appreciate
So,
it.
Dr. Mohamed, you didn't do it the easy way. There was nothing easy about your path to becoming a physician. Can you take us back to being in Somalia? Do you remember anything about that and why your parents decided to come to the United States?
Yeah, I remember the last couple of years before coming to the States, and I remember moving around a lot from Mogadishu to a small town about 40, 50 kilometers from the capital city. And it was really a lot of uncertainty at the time. And coming to the United States was a dream, really, for my parents who maybe 2 decades back had the opportunity to visit here and knew that the many, many possibilities that were ahead here in the States. So when we got the opportunity to leave Somalia, there was a lot of question marks. One was the language, of course, and
What were the 3 words that you knew that were English?
it was book, pencil, and apple.
Oh, my goodness.
You didn't know hello or thank you or
No.
book, pencil, and apple. All right, well,
Book,
that's
pencil,
a start.
Yeah, and the reason why is because I used a book and a pencil every day, and I didn't know what an apple was. So that was just an interesting thing to me, and it stuck with me. So
How many in your family came? Your grandmother obviously was along too, your parents. How many siblings? How many other relatives?
I have 2 siblings and my parents, so all 5 of us first came to the States in 1996. And then 4 years later, my grandmother and other relatives came in 2000 and the early 2000s.
So who gave you the opportunity, and did you know where you were going, and how'd you get here?
Yes, one of my uncles sponsored us, and
And he lives in the U.S.?
he lives in the U.S. He came here long before we did. And then we spent some time in Ethiopia, about 7 months. And at the time, we were preparing to come to the United States. And afterward, once we got that chance, we flew out and landed in New York, spent a few weeks in Maryland, and then moved to Minnesota because we had another relative that was living here and told us about how great of a place it is to live.
No snow in Mogadishu, I would not imagine.
No.
Aside from the weather, it was a great place to be. And how old were you when you came to the doctor with your grandmother to help serve as interpreter?
I was maybe 14, 15.
So you enrolled, once you got to Rochester, Minnesota, you enrolled in the public school system here, and they had English as a second language program for
Right.
you, and you were in that for how long?
Up until 4th grade. So I started from the 1st grade, and at that time I was in this newcomer program, and that's where I was learning the ABCs, and I was learning how to pronounce words and put together sentences. And then I went into the ESOL program in the 2nd grade, when I had enough knowledge to at least read and write. And,
Pencil, book, and apple.
pencil, book, and apple, exactly.
And how were you able to pick up the language so quickly? Being young helped, do you think?
Being young definitely helped because I know a lot of older relatives that came, and it was really hard for them to grasp the language.
And so you would go to the doctor with your grandmother on her visits, and is that what inspired you to become a physician?
Yes, because at the time I had my first biology class when I was in the 7th grade, And I was interested in math initially, but then learning about living things and solving problems combined in medicine is what really got me interested in it, and how much my grandmother was benefiting from it.
And then you finished high school and went on to college. Where did you go?
In high school, I did the post-secondary program, post-secondary enrollment option in the 10th grade, 11th grade and 12th grade. And then
You're motivated.
Yeah, no, what does that mean? You did what?
He went to college while he was in high school.
And yes, I was a full-time student, so I didn't really spend any time in my high school during my 11th and 12th grade years. And interestingly, I went back to my high school, Mayo High School, maybe about a month ago to speak to some students. And I went and talked with my school counselor and just try to, catch up. And she remembered that I was taking so many credits above what was allowed at the time, maybe a few more, just so that I could get my associate's degree while just before I graduated from high school. And I didn't really think that I was doing anything extraordinary. I just wanted to, I had set some goals for myself and I wanted to accomplish them.
What type of medicine did you decide to study? What is your expertise? Which direction are you heading?
Internal medicine. And I specifically want to do primary care. And that's also a little bit unusual in that right now a lot of people are heading towards subspecialties of medicine or surgery if they go that route. And it's all about what you're interested in, really, and what you feel like you could contribute most to.
And where did you complete your undergraduate degree and then medical school?
I went to the University of Minnesota in the Twin Cities, and then I went to Michigan State University, College of Human Medicine.
Was that good?
It was
Spartans?
great. It was great, yeah.
And then you, was this your first choice for a residency? You just say yes.
It was, yes.
Yeah, okay.
Yes.
Hey, and we should say that you said for anyone who's listening in the Rochester, Minnesota area, they'll say, Ahmed Mohamed, I should know who that is, but I don't recognize that kid's name.
Right.
What was your name? Was it your nickname? Is that what your name was?
Yes, Shafi or Shafi'i, if pronounced with the accent.
And that's what your dad called you?
Yes.
And so a lot of your classmates and friends called you that too?
A lot of my friends in the Somali community and my family, and right now even residency, because
Sure.
a lot of people, I tell them that's what I prefer to be called, because Ahmed Mohamed is so common,
Sure.
and there's always a mix-up, getting wrong emails, wrong things in the mail. So
What's it like for your family
Yeah.
to have you become a doctor? I'm sure for your parents, that's the reason why they came to this country.
They're extremely proud, and I feel like they're more of the success story than I am, because when my parents came to the States, it was just our family and the possibilities that are available. And my dad wasn't working in what he was trained when he came to the States. He was an agronomist back in Somalia, and they picked up jobs just so that they could provide for us and live independently. And to have, after 20 years, one of their children become a doctor, that's a huge accomplishment for them. I think if I was a parent and my child became successful after so many years of time, I'd be extremely proud as well.
Go ahead.
Do you think that the success you have had is more related to innate intelligence or hard work? I mean, you come from a smart family. You must.
Yes, I would say both my parents were educated, and I feel like I was fortunate to have their support, their guidance as a child, because a lot of kids don't grow up in that environment, especially in the Somali community.
I was just going to say, at the time that we're recording this, in the Somali community, there is a measles almost epidemic that is happening because of the lack of immunization. I would imagine
Right.
this is just one of the ways that you feel like you're going to be a benefit to your Somali countrymen.
Yes, I would love to inform the Somali community about the benefits in vaccination, and also about the latest information on diseases that are affecting our community in large.
Well, congratulations on all you have done, and thanks so much for sharing your story with us. From Refugee to MD, Mayo Clinic Internal Medicine resident, Dr. Ahmed Mohamed. Thanks so much.
Thank you so much. I appreciate it.